Surprisingly, the rate of hospital infections, the risk per hospitalization has not changed substantially over the last 10 years. But the length of stay, how often people are staying in hospitals, has actually declined over that 10-year period. So on the one hand, people are staying for shorter periods of time, but the risk of getting an infection has stayed the same, which means that the risk adjusted for length of stay has actually gone up. Changing the culture with respect to infections is obviously not easy. Different people have tried different things. There's been experiments with a concept called positive deviance. Others have tried using checklists to implement a specific set of procedures to reduce infections. So we certainly know a lot more about how to improve infection control today than we did about 10 years ago. What we may know a little less about is how to sustain those practices in the long term, and whether just implementing it once will result in a permanent shift in culture. What we also do know is that the incentives for infection control may not always be there. So while any individual clinician may want to make sure that their patients don't get an infection, and nurses may be doing the best job that they possibly can, the hospital as a whole may not bear the cost of infections, but it may bear the cost of infection control measures. Infection control may require having a full-time staff member, being the infection control nurse or professional. It may require specific investments in, caps and gowns, and having hand washing and other equipment in every patient's room. But hospitals may not always see the return on those investments, because even when patients do get infections, the cost of those infections may be borne by commercial insurers or Medicare or Medicaid. So a culture shift in the long term will necessarily involve changing incentives for how hospitals are compensated for infections. The responsibility really belongs to everyone. So hospital administrators have to set the right incentives in place, so they could have specific targeted payment programs or bonuses or rewards to specific wards or personnel who do a good job in infection control. But it's also the responsibility of every last healthcare professional working in a hospital to do a better job in infection control, for two reasons. One is to protect the patient, but second also to protect themselves, because it's also a workplace safety issue. And there's certainly also a huge responsibility for policymakers to ensure that the public safety is ensured by making sure that hospitals have the right incentives to spend the money on infection control. And certainly there's a lot more that can be done on that front than where we are today.